The mysterious disease that hit students at the Starehe Girls Centre is a case of mass hysteria, according to the Ministry of Health. More than 50 students were isolated after displaying high-pitched coughs, vigorous in some cases, alongside fever. The ministry says the investigations into the cold indicated 2 cases of rhinovirus and also maintains that the disease is not infectious.
On Thursday, Starehe Girls Centre's Form 1s to 3 were sent home indefinitely after a disease left over 50 students bedridden and quarantined. The affected girls had a high-pitched cough, sneezed, and had a low-grade fever. The most affected were in Form 1 with about 40 students and only 4 in Form 4. The Ministry of Health says it dispatched a team of experts to the school to carry out investigations. It recommended isolated management of the initial cases. The team collected specimens which were tested at the National Public Health Laboratories. Specialists were also dispatched from Mathare Mental Hospital to run psychological tests on the students. The team concluded that the girls were suffering from mass hysteria, also known as mass psychogenic illness. Medical site Medscape says mass hysteria instances of psychiatric and neurologic symptoms presented en masse. They manifest as outbursts of thrashing and screaming and abrupt vocal tics affecting a group of individuals at once, and often attributed to causes like possession, witchcraft, and malingering. The Ministry of Health in a statement said investigations into the cold indicated 2 cases of rhinovirus, a predominant cause of common cold. However, on October 2nd, the number of affected girls had risen to 68. The ministry has recommended individual psychological evaluation of the affected students. This is meant to understand the trigger of the outbreak. Group therapy for the students, staff, parents, and guardians has also been recommended. Also cited is the need for continuous counseling of the students, sensitization and awareness creation on mental health, and self-care to avert possible future occurrence. The ministry says the illness is not infectious and the situation is under control. Rozongoi, NTV.